Hello, my name is Benedra Williams, Benefits Manager in the Georgia Tech Office of Human Resources. This presentation is for the 2018 open enrollment information. Open enrollment dates are October 30th through November 10th, 2017. All benefit elections and changes made during open enrollment will take effect January 1st, 2018. On today's agenda, I will cover the open enrollment communications, open enrollment changes, be it healthcare and pharmacy, as well as voluntary benefits. Then I'll go over with you how to enroll via One USG Connect or TechWorks. And then we'll have some questions afterwards. As you may know, the University System of Georgia is comprised of 28 state institutions. All institutions adhere to the University System of Georgia policies, guidelines, procedures, as well as benefits. University System of Georgia governs our benefit platform, where as you can see here, the middle of the page, the logo there, that's the benefits logo for USG. The logo also states that we provide, you decide. So you may see this logo on communications going forward as it relates to benefits. You will have a mail out that you'll receive from USG for open enrollment, and you'll see this logo on there as well as the top logo, University System of Georgia. For those of you who may be aware, maybe those that have not had a chance to go out and visit our new benefits platform, we have a new benefit administrator, which is One USG Connect. One USG Connect is where all University System of Georgia government benefits are housed. They're there for new hire enrollment, open enrollment, life status changes, as well as COBRA, leave of absence benefits, and retiree benefits. All right. And so once again, that middle logo, that's for University System of Georgia Benefit Administration. All of our benefits are governed by the University System of Georgia. And there at the bottom, you see the Georgia Tech logo. And this just simply states that Georgia Tech is one of the University System of Georgia schools. And for example, we have Georgia Tech, we have Kennesaw State, we have University of UGA, Georgia Southwestern. All of those are just few examples of the state schools that fall under the University System of Georgia umbrella. So remember, all of Georgia Tech employees, we are University System of Georgia employees. Open enrollment communications. You'll see before you the open enrollment postcard for 2018. And it reminds you of the 2018 open enrollment dates. Those dates, once again, are October 30th through November 10th. This year's logo is explore your choices, embrace your well-being. So the postcard is simply just giving you a reminder about open enrollment, the open enrollment dates. On the back side of that card, it gives you information of how to sign up for open enrollment reminders via text. If you text USG to 23613, you'll receive open enrollment reminders throughout the 2 weeks for open enrollment this year. So by all means, if you would like to, go ahead and sign up for the USG open enrollment text reminders. So again, these postcards were just sent out to just make you aware that open enrollment was coming. And now we're in open enrollment. We're on day 3. Today is November 1st. Open enrollment started on Monday, October 30th. Once again, and goes through to November 10th. And so these postcards were mailed out the week of October 9th. If you did not receive a postcard or any mail-ins from USG, please log into TechWorks and confirm your mailing address. Again, please log into TechWorks and confirm your mailing address if you have not received any open enrollment mailings. Now before you see the USG Benefits newsletter. So again, this is One USG Connect. One USG Connect, they govern all of our communications. They come down again from University System of Georgia. So this is their benefits newsletter. It's like a 4-page brochure that was mailed to your home the week of October 16th. Now, in this USG package, you'll also receive a benefit summary. That benefit summary is a statement of your benefits as they are prior to open enrollment. So, currently here in 2017, you'll see a summary of your benefits, the charges that you adhere to per pay period. And so, additionally, in that communication, you'll have an enrollment worksheet. So, you'll have 3 items there in your One USG Connect mail-in for open enrollment: the USG newsletter. This is for active employees. The USG benefits newsletter, the enrollment summary, and enrollment checklist, enrollment worksheet. So please take a look at that information. If you have not been out to One USG Connect prior to open enrollment, you'll have that summary before you, so you can take a look at your benefits to see as they are. And if you'd like to make changes, you can log on to the portal to make those changes, or you can call the toll-free 800 number to the dedicated call center for USG employees to make your changes over the phone. Now, an additional communication that was sent out this year for open enrollment was from the Office of Human Resources, Georgia Tech Office of Human Resources. The benefits team sent you out a letter that speaks about the Georgia Tech specific benefits. So, as I stated earlier, the University System of Georgia governs all of our benefits as they are today in One USG Connect. However, prior to moving to that platform, Georgia Tech has some standalone benefits that USG did not offer our employees. And so there was an exception made for Georgia Tech to keep those benefits. Those benefits are Georgia Tech identity theft, the Georgia Tech Delta Dental HMO plan, Unum whole life insurance, and donated sick leave. So there are 4 benefits there that USG's benefit newsletter does not contain. And so is the reason for the separate mailing from Georgia Tech's Office of Human Resources. So please make sure you pay attention to both mailings. Both mailings contains important information for you for open enrollment this year. All right. Now before you is the USG retiree brochure for any USG retiree who still has medical insurance, medical, dental, vision, and or basic life or supplemental life insurance. You will receive this USG retiree brochure. Now, we do understand some of your benefits may be through the Aon exchange if you're 65 years of age or older and have Medicare A and B. However, this brochure will still be mailed out to you just to make you aware of any USG retiree benefits that may have changed in 2018. And so far, there are no changes. But again, this communication will be mailed out to all University System of Georgia retirees. This was our open enrollment poster. Open enrollment poster should have been posted in your various departments or units around campus. It's simply advertising the benefits fair. We did have our benefits fair last Wednesday, October 25th, in the Georgia Tech Student Center Ballroom. The benefits fair is one of the largest ones here in the state of Georgia. We had about 30 or more vendors that came out. Those USG benefit vendors, they were out and they were there to address any of your questions or concerns about your current benefits or future benefits in 2018. They gave away free door prizes, trinkets, and there was also a catered lunch for those individuals who attended. So if you did miss it, you missed out on a great event this year, and we hope to see you next year. And also on the poster, you will see open enrollment dates. If you don't have any of these posters posted in your unit, please reach out to the Georgia Tech Office of Human Resources, and we'll be sure to get some posters out there to you. We want to make sure that all employees are aware of open enrollment. Which open enrollment is the period in which you can make changes to any and all of your benefits, all except for your University System of Georgia core retirement plan. But yes, you can make changes. You can add dependents, drop dependents, change medical plans, dental plans, vision plans, your tiers of coverage. You can do all of that during your annual open enrollment period. Remember, your open enrollment changes will take in effect January 1 of 2018. Here's some general information. As we already discussed, the benefit fair was last week, last Wednesday. The open enrollment dates are stated here. And over to the right, you'll see the campus, open enrollment campus information sessions. These sessions took place in various places around campus to be more accessible to different units around campus. We had them at different times as well. And so we'll continue this outreach on an annual basis just to make sure everyone has accessibility to this information. So we'd like to get the word out about the changes to make sure you're equipped with the most up-to-date information in regards to open enrollment. We also have our website there stated at the bottom, ohr.guitech.edu/open enrollment. Out there on our website, we have the mail-ins that with the communication materials that we just went over. There's soft copies of those documents out there on our website. We have the Georgia Tech letter, open enrollment letter for actives. We have the retiree brochure there. The retirees also received a letter from the Georgia Tech Office of Human Resources, so that's out there. And then we also have links out to University System of Georgia benefit open enrollment page, where you can obtain copies of that USG newsletter. All right. And they have a plethora of other information out there on the USG website because, again, remember, USG governs all of our benefits except for those, the ones I stated earlier that Georgia Tech was permitted to continue. All right. General information. So this year's open enrollment is a passive open enrollment. And what does passive open enrollment means? It means that you do not have to take action during open enrollment if you'd like for your benefits to remain the way they are in 2017 for 2018. So again, if you're enrolled in coverage and you do not wish to make any changes, your elections will roll over as they are. This also includes tobacco surcharge. If you're currently not paying tobacco, you're not a tobacco user, you're not paying that tobacco surcharge, and you do not log in during open enrollment, that will roll over to the next year. You do not have to go in and make a tobacco attestation this year. So again, it's passive open enrollment, and all of these are these two items, being passive and no tobacco surcharge attestation, is fine, except for there is an exception for flexible spending accounts. So a flexible spending account is an IRS guided account, whereas you put aside pre-tax dollars for your qualified medical and or dependent expenses. That plan requires re-enrollment each year. So if you're currently enrolled in a flexible spending account and you'd like to continue that flexible spending account for 2018, you will have to log in to One USG Connect or give them a call and re-elect that plan for 2018. All right, flexible spending accounts do require action. Even if you are not making any changes, we would like for you to go out to TechWorks and confirm your address. All right. Your address is very important, whereas that's how the University System of Georgia communicates to employees. Usually it's through your mailing address. So by all means, if you didn't receive those communications that I spoke about on the previous slides, you would want to go out to TechWorks and make sure your address is up to date and we have the most up to date information. Beneficiaries. And we did transition over to the new benefit administrator July 1st this year, 2017. And with that being said, you want to make sure that your beneficiaries are correct as well. So maybe you don't have any benefits with USG, but you do have your free $25,000 basic life insurance. Make sure your beneficiaries are up to date. Forbid anything happen, we want to make sure we are able to contact your loved ones and make sure they are able to receive the benefits from that plan. Also confirm your elections. So although you will receive them in the USG newsletter mailing, your elections, your current elections for 2017, go out to the system and familiarize yourself with it. Take a look around. Maybe there's a benefit out there that you didn't know about, and now's the time that you'd like to enroll. So please go out, confirm your elections, your beneficiaries, as well as your address during open enrollment. This is your time to explore your choices and embrace your well-being. All right, so once again, University System of Georgia governs our benefits. Next year in 2018, They will continue to offer the same four medical plans, and they are the Consumer Choice HSA plan, Comprehensive Care Plan, Blue Choice HMO, as well as the Kaiser HMO. And just to give you a recap on those plans, with the Consumer Choice HSA, remember HSA is a health savings account, but the Consumer Choice HSA is a POS plan. So it's the Comprehensive Care Plan. They both offer in-network and out-of-network coverages. In-network means that your physician accepts your insurance and benefits are paid at a higher rate. Out-of-network means that your physician does not accept your insurance, but you will still receive benefits. Benefits will be paid at a lower rate by Blue Cross Blue Shield, but you do still have benefits and can be seen by that doctor, by that physician, because you have insurance coverage. It's just benefits are paid at a lower rate by Blue Cross Blue Shield. All right. Now, also for our out-of-state employees, you may find doctors, physicians in your area that accept these plans, even though they're out-of-state plans. If you live in Alabama, Florida, California, we have employees all over the U.S. But even if you live outside of the state of Georgia, these top two plans do offer you in-network and out-of-network coverage. You may find physicians in your state that accept that insurance, and so they will be billed at an in-network rate. If they do not accept the insurance, you still have insurance. It'll just be billed at a lower rate under the out-of-network bracket. Okay. These the top two plans also, you administer your health care. As long as your provider, your physician accepts the insurance, or even if they don't, you administer your health care. You can go to a general practice physician or a specialist as long as they accept the insurance. All right. Also, with that, on the first plan, the Consumer Choice HSA plan, this plan allows you access to put aside pre-tax dollars in a health savings account. That health savings account can be used to pay for your out-of-pocket expenses, such as those doctor's office visits. The doctor's office visits under that plan, actually, they are subject to your deductible. The deductible is a very high deductible. For a single or a family member, a family of two or more. However, you may never reach that deductible, and that's perfectly fine. This is a consumer-driven plan, meaning that you use the plan as you need to use it. Now, wellness visits are covered at 100%. Wellness, that's your once-a-year physical or any gender-appropriate tests that you may have. That's wellness is 100% covered throughout all four of the USG plans. So you never have to pay a copay or any type of deductible when you go in for those visits. However, when you do go to the doctor under the Consumer Choice HSA plan, if it's a general practice, maybe it's a common cold visit, you will pay 100% of the contracted rate. And you may ask, what does that mean? 100% of the contracted rate. That's the contracted rate between the physician and Blue Cross Blue Shield of Georgia. So for a common cold visit, it may cost you around $120. But if that's the only visit you have throughout one calendar year, then you may come out with a major cost savings as opposed to being enrolled in any of the other plans. The premiums for the Consumer Choice HSA plan are very low, considerably low. For a single person enrolled in the plan, currently in 2017 is $74. All right. So as opposed to paying $180 a month for under the comprehensive care plan, you're only paying $74 a month. But that may be beneficial to a person who never goes to the doctor. If you never go to the doctor, you only go once a year for your physical, then this plan may be beneficial for you to have, you or your family members. All right. Even with those deductibles, remember, if you go to the doctor just that one time throughout the year, you may never reach that deductible, and that's fine because, again, you're saving money there. With that HSA, when you're putting money aside into the health savings account, it's on a pre-tax basis, and there's an employer match there as well. We'll go over that a couple of slides ahead, but excuse me, that health savings account, you put aside that money to pay to offset those expenses that you incur when you do go to the doctor. All right. That's the way the plan is set up to operate. You also have access to a limited purpose flexible spending account. So by being enrolled, you have to be enrolled into the Consumer Choice HSA plan in order to have access and make contributions to an HSA and or the limited purpose flexible spending account. Now, our visa holders, J1 visa holders, you unfortunately, you are not able to enroll in this plan due to your visa guidelines. You can only enroll in a plan with a deductible of $500 or less, and this plan's deductibles are higher than $500. So you are not eligible to enroll in this plan, the Consumer Choice HSA. Right. So now moving on to the the comprehensive care plan, which is a point of service plan. Remember, it still has in network and out of network. This plan has copays. It has copays and deductibles. Remember, with the Consumer Choice HSA, there are no copays involved there. But with the comprehensive care plan, you do have copays for your general office visits and/or your specialist visits. Now, for any visits outside of doctor's office visit, maybe it's an outpatient surgery, or maybe it's outpatient surgery, or maybe it's a medical service, a medical test, maybe it's an MRI or a CAT scan. So those type visits, you would have to pay towards your deductible. All right, same thing here. You never have to reach the deductible, but for any visits outside of general office visits, you do have to pay for those. And an MRI, just depending on what area it's in and what area of town that it's in, any different facilities, various facilities charge different rates for those type services. And so again, it's subject to deductible there. And once you reach your deductible, it could be in either one of these top two plans. Once you reach your deductible, then you have an annual out of pocket maximum. That's the most that you will pay for medical services out of your pocket, given that within that calendar year. Right? So you do have a maximum there. And once you reach your maximum out of pocket, then Blue Cross Blue Shield of Georgia will pay for your medical services 100%, no cost to you for the remainder of that year. All right, so that's the benefit there. And so again, you may never reach the deductible or the annual out-of-pocket maximum, but again, you have the insurance coverage. That's what insurance is here for just in case you need to use it, you have it and you're covered. All right, now, so moving on to the bottom two plans. The first one is the Blue Choice HMO. That's through Blue Cross Blue Shield of Georgia. And the second is Kaiser HMO. HMO means Health Maintenance Organization. Under these plans, you must sign up with a primary care physician, otherwise known as a PCP. Your primary care physician actually administers your health care in the HMO. They state whether or not you need to be seen by a specialist. They have to refer you out to be seen by a specialist. So for all your healthcare needs, you will always go through your PCP first. All right. The HMO plans are Georgia-based plans. So coverage is only permitted inside the state of Georgia under the HMO plans. Now, with that being said, if you do travel outside the state of Georgia under these plans and you need to seek medical attention, routine medical services are not permitted. They are not covered outside the state of Georgia. However, if you do experience an emergency, emergencies are covered on a per occurrence basis. So they would take whatever occurrence that happened, they would take a look at it, see if it is indeed an emergency, and they will cover it. All right. But if you are living outside the state of Georgia and you are a Georgia Tech University System of Georgia employee, and you're thinking about enrolling in the HMO plans, be mindful that these plans are Georgia-based plans. These plans are set up like strictly copays. There's no deductibles, there's no co-insurance or any annual out-of-pocket maximums under these plans. All right. So every service underneath that within the HMO plans, there's a copay associated with each service. All right. Now, there's also pharmacy coverage in all of our plans. The pharmacy is embedded in the plans, each of them individually. The Blue Choice HMO plan, as well as the Kaiser HMO plan. Now, Kaiser, you may have seen the facilities around Metro Atlanta. I call them a one-stop shop. So your PCP is in there, the pharmacist is in there. Your pharmacist as well as a specialist. If your doctor refers you out to see a specialist, typically your specialists are housed there in that facility as well. They do contract with other doctors around Atlanta outside of Kaiser facilities. Not too many, but they do have some doctors there that they contract out that are outside of Kaiser facilities. Now, I know we spoke about PCP referring you out to different specialists. Just know chiropractic, dermatology, as well as gynecology. Those you do not need a referral under the HMO plans. If the doctor accepts your insurance plan, you simply make an appointment and you go. All right. So I know we spoke about the health savings account earlier, and so there may be some questions about the medical flexible spending account. So that's another pre-tax savings account that you put money aside to pay for qualified medical expenses. It could be medical, dental, or vision expenses. Pharmacy is included there. Now, if you're enrolled in plans 2, 3, and 4, you can put money aside in that health flexible spending account to help pay for your co-pays or your co-insurance or your co-pays at the pharmacy, right? Dental, if you have, or maybe your children or you have major dental expenses, you can put aside those pre-tax dollars in that flexible spending account to help pay for those expenses. Eyeglasses, contacts can be used the same way. Right now, with the flexible spending accounts, now there are no employer matches there, so it would be an employee only contribution type plan. The cost savings to put money aside in that flexible spending account, it varies. It really depends on your tax bracket as to how much you'll save by putting pre-tax dollars in those flexible spending accounts. All right. And so that pretty much covers here the four medical choices for 2018. Just giving you a refresher there. Well, now we'll move on to the changes for 2018 to the medical plans. For all four medical plans, we have a new benefit that's been added, and that's for hearing aids for coverage for our children up to age 18. It's up to $3,000 per year per impaired ear. So that coverage will be available in 2018 for children. Next up, we have the comprehensive care plan, whereas there's an increase to the in-network annual out-of-pocket maximum. So I just spoke about the in-network, out-of-network, what that actually means, and that I also spoke about the annual out-of-pocket maximum. That's the most that you will come out of pocket outside of paying your monthly premiums that are automatically deducted from your paycheck. But these are for the health services. Maybe if you are having an outpatient surgery, or you're going to get MRIs or CAT scans or anything outside your general office visits, general or specialist visits. This is your annual out of pocket maximum. That's the most you'll come out of your pocket for medical service under this plan for a calendar year. And so the maximums have increased next year for 2018. You'll see their single increases up to $1,500 and family two or more increases up to $3,000. Right. And so the annual out of pocket maximum does incorporate your deductible. Once you've met your deductible, then from that point on, the difference of for you to reach your annual out of pocket maximum. All right, so there are only two medical plan design changes in 2018. So there are not a lot of changes here to the medical plans. Now, there were rate increases for 2018. The rate increases weren't that large either for 2018. Luckily, we came in just under our projected healthcare costs for 2018, so we kind of had a cost savings there when we talk about the rate increases. For instance, the Consumer Choice HSA medical plan for 2018 is $75.12. Currently in 2017 is $74. So there was only $1.12 increase there. Now, if we look at the highly utilized plan with dependents with family coverage, that's our Blue Choice HMO plan. Currently, for family, it is around $588. And in 2018, the price increases to $611.20. Okay, so that kind of gives you an understanding of how much the prices increased. There was an up to 11% increase in healthcare costs and healthcare rates for 2018. right? Now, so now you will see in the USG newsletter that you receive, that package, you will not see the rates. Usually we'll have the rates posted in there, but USG decided not to post the rates in there. So you will have to visit when USG Connect to take a look at the rates and see how those rates would differ from 2017. All right. Pharmacy plan changes. So as I shared with you earlier, all of our medical plans have pharmacy coverage embedded in them. And for the for the Blue Cross Blue Shield plans, CVS is our pharmacy benefit manager. I know I don't want to don't want to have you confused with the CVS pharmacy, but this is the pharmacy benefit manager. So all of your prescriptions, they go through CVS Caremark to be processed and give you your copays, give you your applicable rates. So it doesn't mean that you have to go to a CVS or a CVS to fill your prescriptions. You can continue to go to Rite Aid, Walgreens, Publix Pharmacy, Walmart's Pharmacy, any of those participating pharmacy. And we actually have an on-site resource now, Stamps, our Stamps Medical Center here on campus. They are now participating pharmacy. So if you need to get a prescription filled here on campus, here on the Atlanta campus, you can do so at Stamps. So check that out if you need a close by pharmacy to get a prescription filled. But on with the pharmacy plan changes for 2018. The out of pocket maximum tiers have increased by $150 per person under the comprehensive care plan. All right. So just like we have an out of pocket maximum for medical plans for the medical services, there's an out of pocket maximum for your prescription coverages as well. It's totally separate of each other. Right. So these rates, your out of pocket maximums have increased for 2018. All right. And so just to reiterate some pharmacy guidelines, site of care alignment for 2018. CVS Caremark is partnering with Blue Cross Blue Shield of Georgia to assist USG members with identifying the most appropriate site of care for infusion therapies. We don't have a large number of employees using infusion, well, that have to take infusions or what have you. But for those that are, just know that USG has worked on your behalf to find facilities, site of care for these infusions to be at a lower cost to you. So instead of going to the hospital or maybe even the doctor's office, maybe maybe the infusion can be administered at your home. Again, that'll be a most cost savings to you, the member. So by all means, if this is applicable to you, feel free to call CVS Caremark directly to orchestrate and set up the best site of care for your infusion. All right. All right, so brand generic guidelines, well, it's really more so dispense as written. Dispense as written is an order on a prescription that requires a pharmacist to provide the member with the prescription exactly as it was written. So most times you may run into, I'll say this, your medical plan, Blue Cross Blue Shield of Georgia, CVS Pharmacy, the most cost effective the most cost effective for your copay schedule is your generic brand. All right, your generic drugs. Now, if you run into a situation where you or your physician feels that you cannot take a generic drug and you should be dispensed a preferred brand name drug as opposed to generic, and generic is available, your physician will have to write that on the script. Your script has to be written and saying that this member, this employee, this patient must take this preferred brand name drug as opposed to the generic. And if it's written that way, you maybe dispense the preferred brand name. With that being said, there is a penalty involved because your plan prefers the generic to be written and taken, but we all know we have different circumstances that may prohibit us from taking the generic. But with that being said, yes. So there is a penalty involved. The penalty involved is your preferred brand name drug minus the generic copay cost. All right. So you'll subtract that from the preferred brand name, and then that's your payment. So your payment is the difference of those two, the preferred brand name and your generic cost. right? So that is your penalty. And we did have some questions on, well, what if the generic is not available and the preferred brand name? So there's two different things there, two different ways to look at that question. Now, if your retail pharmacy is simply out of the generic drug, and they have another retail pharmacy within their chain or what have you to reach out to, maybe to deliver more, then that's typically what will happen. They'll replenish their supply and dispense that generic drug to you. But now, say the preferred brand name drug that you're taking does not have a generic brand, does not have a generic drug, uh, generic version of it. Then, with that being said, you'll need to call CVS to kind of coordinate that. They'll help coordinate that to make sure that you're not paying the penalty, especially since a generic is not available for that drug. All right. So main thing here, make sure your physician is writing out your prescription just the way it needs to be dispensed. New ID cards for 2018. So employees who are currently enrolled in a plan and do not make any changes during open enrollment, you will not receive a new card. That's for Blue Cross Blue Shield and Kaiser members. So you'll continue to keep your same card for 2018 and obtain services based off of that card. Now, if you decide to switch plans in 2018, you as the member, or you're adding a new dependent, or you're a new enrollee to any of the USG medical plans, you will receive a new card from either Blue Cross Blue Shield of Georgia or Kaiser, either or. So if it is Blue Cross Blue Shield of Georgia, the new cards, they look just as they are on the screen. There's a blue strip at the top and a blue strip at the bottom. So nothing to be alarmed about. It's just a new look here. Kaiser does not have brand new cars, but they don't have a new look. But again, if you experience any of these three things here on the screen, then you will receive a new card or your dependent will receive a new card for Kaiser. All right. All right, so here are some additional changes to benefits in 2018. And so we'll start here with your health savings account, your HSA. Remember, you must be enrolled in the Consumer Choice HSA medical plan in order to contribute to the Health Savings Account. HSA is a pre-tax benefit. You put aside pre-tax dollars into a health savings account, which is our vendor is Optum. Okay, Optum will send you out a Mastercard logo debit card. That's where your funds will be available for use. If you have funds in the account, you simply swipe it at the point of sale or at the point of service, and your contribution, excuse me, the money in that account can be used to pay for those services at the time. And remember, that's for both medical, dental, vision, as well as pharmacy. So those cards can be used for all of those services as long as it's a qualified medical, dental, vision, pharmacy expense. Now, for your contribution limits for 2018, they have increased. For an individual, it increased by $50 up to $3,450. Family, which consists of two or more, it is increased to $6,900 for 2018. So that's the most pre-tax contributions you can contribute to the HSA in the new year. You also want to consider that with those contributions, that the employer match is included in those numbers. So those numbers, you would have to lessen them by the employer match for the year. It's a match. USG is contributing to your HSA. For single, it remains at $375 for the calendar year. For family two or more, it is $750. Okay. And with that being said, with the HSA, some things to take note on with the HSA, you can pledge an annual amount, and then it is divided throughout your pay cycles for the rest of the calendar year. It's taken out of your paycheck and contributed on a pre-tax basis directly to your health savings account. Now with the HSA, you can make changes to your contribution. You can increase it or decrease it on a per pay period basis. It's totally up to you. So there's some flexibility in your contributions and the way you contribute to this account. Now remember, the employer match is a dollar for dollar match. So if you say you want to put in $50 for the first 2 months, 18, USG will put in $50 in January. They'll put in $50 for February based on your dollar for dollar match. Now, if you change your contribution for the month of March and you decrease it to $25, USG will decrease their match to $25. So if you fluctuate, if you change your contribution, USG will change theirs. Again, it's for dollar match up to these amounts here on the screen for the match for 2018. Okay. Now another tip here, key point with HSAs, the amount, if you do not use your contributions by the end of the year, your amount rolls over to the next year. All right. And you can continue using those funds. I do often get a question, well, what happens if I'm enrolled in the Consumer Choice HSA plan for 2017 and I have $800 in my health savings account? What happens to those funds? What happens to those funds if I change to the HMO next year? Actually, that account, the money in that account is yours. You own the funds in that account, both the employer contributions and employee contributions. They still roll over to the next year, and you can use them, you can continue to use that account until the funds are depleted, only on qualified medical, dental, vision, pharmacy expenses. All right, so you own those funds and they roll over on a year to year basis. If you contribute as much as $1,000, then Optum will mail out investment options to you. You can invest those funds and grow the funds in that account. All right. Now, if you are an active employee age 65 and reach age 65, you are no longer eligible to make contributions to the HSA account. And that's one thing. When USG, they will reach out to you and let you know if you fall in that category, and they will stop your deductions into your contributions into that health savings account. Right, so that is the health savings account. Another question we often get is, can I have an HSA and a flexible spending account? Now, by being enrolled in the Consumer Choice HSA plans, I stated before, you have access to the HSA and the limited purpose flexible spending account. Now, you can also make contributions to a dependent flexible spending account, but you cannot make contributions to the HSA as well as a medical flexible spending account. Okay. Now, with the limited purpose flexible spending account, that is available for dental and vision expenses only. Why would one put money aside, extra money aside in the limited purpose account? Well, if you look at the deductibles for the high deductible healthcare plan, the Consumer Choice HSA plan, the deductibles exceed the amount that you can contribute into the health savings account. All right. And so one may want to put aside extra funds for dental or vision expenses. Maybe you're having LASIK surgery next year. Maybe your children have braces and you want to put aside extra funds there in that flexible spending account, limited purpose flexible spending account for those type of expenses. That's a couple of reasons why you put money aside, that you utilize a limited purpose flexible spending account. All right. Now on flexible spending accounts, now, the rules are slightly different. If you do not use the funds at the end of the plan year or the end of the reimbursement period, you lose the funds, you forfeit. This is a forfeit plan as far as the funds that you contribute to the account. So when you are looking to pledge, looking for the amount, or trying to think about how much you should pledge or put into this flexible spending account for 2018, you always want to pledge low instead of high, because you want to make sure that you're able to reimburse yourself, all right? Be able to use the funds and not forfeit them. Another question there is, what happens with those funds that are forfeited? Those go toward the plan administration, the administration fees for the plan. Okay, but the main thing here is just to make sure that you utilize all of the funds in that account and not to forfeit them. Now, there is a grace period for flexible spending accounts. This is for medical flexible spending account, dependent flexible spending account, as well as limited purpose flexible spending account. If you do not use the funds by December 31st, there is a grace period to March 15th of the next plan year for you to use the funds in that account. Now, still, if you don't use those funds or claim them by March 15th of the next year, you still forfeit those. You still forfeit the funds, the unused funds in that account. Although it just gives you a little more time to get in receipts or maybe even new expenses in the new year. You can still utilize. You can utilize the money in that plan through the grace period for previous year expenses and current year expenses. Now, the Optum Mastercard is used for all four plans that are offered: the medical dependent, limited purpose, flexible spending account, as well as the health savings account. And so if you do have one or more, it's a smart card, so it knows to use your flexible spending account before it utilizes your health savings account funds. The card is also smart enough that it knows our copays that are associated with medical, dental, and/or vision. All right, and so if you're swiping the card during the at the point of sale, point of service, it knows, okay, a vision eye exam costs this much under our vision plan, so it accepts that. It accepts that charge. Now, if there is a charge that is not within our copay schedules, and it could be like maybe it's the use of dental expenses, maybe you're having a dental surgery or something. It'll allow you to swipe the card there at the point of sale, but it will require you to submit an itemized receipt to Optum to validate, to confirm that charge, to make sure that it is FSA eligible. All right, so it does take some time for it to go through the system, but Optum will send you out a communication via mail as well as email requesting that information. And so here, flexible spending account limits have increased for 2018, and that's for healthcare as well as limited purpose. They've increased to 2,600 for the 2018 calendar year. All right, moving on to dental. So the dental plan designs have not changed. They have not changed. This slide here is just giving you the information as far as the rates for the dental plans. And please note, remember that the Delta Dental HMO plan is a Georgia Tech benefit. You will have access to enroll in it, be it over the phone or through the portal. As far as the HMO plan, however, it was not included in your USG benefit newsletter. And so this is one of the reasons why Georgia Tech sent out a separate communication to advertise to make sure that you're aware of the rate increase for the Delta Dental HMO plan. All right. So there was a 3% increase here. Our our premiums have been stagnant over the past 5 years. So this is the first increase for the Delta Dental HMO plan in 5 years. If just to give you an example of the increase, if you have Delta Dental HMO employee only in 2017, it is $18. And so here for 2018, it has increased by 54 cents. Okay. Now, a little bit about the dental plans. So, yes, you do have three options. You will have three options there in One USG Connect. You have the base, the high, and then the HMO plan. Now, I'll kind of stay on the HMO plan here for a second. HMO plan is a Georgia-based plan. So, if you live outside the Georgia state lines, then this plan may not be beneficial for you. It is set up strictly of copays only. All right, and those copays incorporate both what the insurance costs, what the insurance has paid, as well as what you are required to pay for that service. There's no co-insurance or no deductible that has to be met here under the Delta Dental HMO plan. Now with the base and the high plan, there are deductibles to be met: 50 single, 150 for family, two or more. All right. There are annual maximums. The annual plan maximum for the base is $1,000. Annual plan maximum for the high plan is $1,500. That's the most that Delta Dental will pay toward any of your dental expenses for the calendar year. Please note that preventative and diagnostic tests and your once a year test there, exams, as well as your preventative care, meaning your cleaning once every 6 months cleanings, they are free of charge. That's preventative care. All right. So they're free of charge under these plans, kind of like your wellness benefit under your medical plans. But now, if you have basic services or major services, that's where your co-insurance kicks in. You pay your deductible, and then Delta Dental will pay, the amount that they'll pay towards your dental services. Okay. And remember, flexible spending accounts and health savings accounts, they can help offset some of your dental expenses. So if you know you're having maybe major dental services next year, maybe if you're enrolled into the HSA medical plan, then you can put aside some additional funds in that HSA or your limited purpose account to help offset those expenses. All right. So definitely these are benefits that you can utilize and use as you need. Remember, your benefits are all a la carte. You do not have to sign up for each and every benefit. You pick and choose which benefits you'd like to enroll in. All right. Vision, your vision option for 2018 remains the same. There's one option there, and it is iMed Vision. Same thing here about the rate increase. We've sustained the rate for the past 5 years, and this is year 6, and so there is an 8% increase, and these are your vision rates. There was a decrease in the cost of the standard contact lens fit and follow up, so that's a cost savings there for you. That's embedded in the plan for 2018. Okay. And so that is iMed. iMed does have in-network as well as out-of-network coverages. And I forgot to mention that with the dental, your base and your high plan for dental, there are in-network and out-of-net coverages there. For your vision plan, they have in-network rates, and then they have out-of-network reimbursement rates. So if you're going to an optometrist, maybe a boutique type optometrist, they do not accept our insurance, and you do want to enroll into the iMed plan, you do have reimbursement options here. They're not as rich as the in-network benefits, as all plans are. But you do have some type of reimbursement schedule there for vision expenses if your optometrist does not accept iMed. Lifestyle benefits. So the rates for these packages have increased in the new year. If you can remember, lifestyle benefits is comprised of different options, different packages of discount programs. So you have the emergency roadside assistance, the USG identity theft protection, tax helpline, pet care, and fitness club discounts. Remember, these are not insurance plans, they are discount plans. And you'll have 4 options, options A through D to select from. And there was a minor increase here to the packages as far as the prices. Hey, new in 2018 is Purchasing Power. Purchasing Power is a Georgia based e-retailer company that gives you access to online purchasing of electronics, appliances, lodging, and vacation packages. Plenty more other options out there as well. The benefit here is that you can shop online and select whichever product you'd like. It's delivered to you, and you have the option to um, these the products you choose payroll deducted between 6 to 12 months, 6 or 12 month period. Right? There is a 14% markup here on the products through the e-retailer Purchasing Power. So this benefit can be used mostly used for maybe emergency type situations. Maybe there's an unplanned trip. Maybe you need to go see a sick loved one abruptly, and so instead of if you don't have the money up front to pay through whichever resources you use, then you can go out through Purchasing Power, find a flight ticket, and just pay for it over 6 to 12 months. Hotels, the same thing. Maybe it's a major appliance. Your washing machine is out of commission. You need a new washing machine and you don't have the money to pay cash there in the store, or you do not want to or can't take out a line of credit. Then this is the option for you, Purchasing Power. So it's a benefit here to fill in those gaps of unexpected things that happen in life in general. Now, for eligibility for the plan, you must be a full time employee. That means working at least 30 hours a week or more and employed for 12 months. The minimum salary required, you must make at least $20,000 per year. And when signing up, you must sign up with a backup payment method, be it debit card or credit card. Right. So purchasing power, you do not have to enroll in it during open enrollment. Actually, it'll be released in January of 2018 inside the One USG Connect portal. There'll be a link to link you out, and you can link out there and search on their site. You have to search on their site and purchase on their site in order to qualify for the benefits and have qualify for the benefits according to this slide here. Right. So be on the lookout for purchasing power in January 2018. There is a new well-being initiative that will be introduced as well in January 2018. It does not require any sign up. The only thing is there you must be enrolled, you or your spouse must be enrolled in a Georgia Tech, a University System of Georgia medical plan. Once you're enrolled in that medical plan, they will introduce the new well-being well-being initiative of $100 there, and they'll let you know. They give you more details at that time. Unfortunately, we don't have all the details ironed out right now, and that will provide you more information in January as to how you can and will receive the $100 incentive. It could be if you walk 2 miles a day, you're able to register that. Maybe you're logging in your miles or activity on the site. They'll give you maybe $10, here, $10 there. So it's whatever goal that they set out. And if you meet that goal, they will compensate you. It could be $10 off your monthly premium. It could be a gift card in the mail. So those are the type things that USG is working on for us in regards to this incentive. So just be on the lookout for more information to come on this $100 well-being initiative. Okay, so some things to remember. So as I stated earlier, there were two open enrollment communications that went out, one from Georgia Tech and one from University System of Georgia. And so in the Georgia Tech mail out, we have a donated sick leave. Donated sick leave pool is a campus donated sick leave pool. So we have one for campus in general. Then GTRI, they have a separate way that they enroll in donated sick leave pool. It's via paper, but everyone else will be able to enroll through TechWorks. TechWorks, once you log into TechWorks and you click on the Georgia Tech open enrollment icon or the link there, you'll be taken to the donated sick leave page. Donated sick leave pool is sick leave hours available to members of the donated sick leave pool. All right. And so that's for one that may experience an FMLA eligible type of occurrence. So if it's maternity, if you're having a baby, if you're experiencing a terminal illness, maybe it's not a terminal illness, but it's just an illness in general that you cannot work, that the doctor deems you unable to work, and you do not have maybe a disability, or you don't have any sick hours left in your personal sick leave bank, you can apply for hours from the donated sick leave pool. All right. There have been questions in the past. Someone is retiring or they're leaving and they have a nice amount of sick hours left and they want to donate it to someone individually. Unfortunately, you cannot. We do not have that mechanism set up. And so this is a USG policy. Once again, they govern all of our policies and procedures. And so that's why we have this donated sick leave pool. You donate your hours during open enrollment only. Donate your sick leave hours, a minimum of 8, maximum of 80. And so you donate your sick leave hours there. And whenever someone needs to use the hours, they'll go through a very confidential request application process there. All right. And so FMLA, remember, it can include the employee. It could be a sick loved one. As long as it is FMLA eligible, they can apply for the hours and they'll be able to reap the benefits if it's approved. Now, with the membership, for eligibility for the membership of the donated sick leave pool, you must contribute at least 8 hours. So it's a one-time contribution of at least 8 hours. This policy began January 2017. So if you made a contribution last open enrollment, that was last fall, October, November 2016, if you made at least 8-hour contribution, then you are a member of the donated sick leave pool. You should have received a confirmation email. And so if you contributed last year, you do not have to contribute again. So if you missed out last year and you'd like to become a member of the donated sick leave pool, just in case for your own needs, then you must contribute at least a minimum of 8 sick hours during open enrollment. And the catch there is you must have at least 40 hours of sick leave left over after your donation. Right? One-time donation of 8 hours, but you must have at least 40 hours left over after your donation. After open enrollment, you will receive a confirmation email, which will let you know that you are donated sick leave pool. Again, one-time donation needed there. All right, and so next up is identity theft, re-enrollment. So those of you all who were employed with Georgia Tech last year, late last year, November, December, around November, December 2016, we had a data breach where data was compromised, and Georgia Tech decided to offer free identity theft for the 2017 calendar year. So if you don't know, but you are enrolled, you should have received a mailing around this information. But you were enrolled in you were enrolled in identity theft for 2017, and Georgia Tech paid for it. Now this enrollment actually expires December 31st of this year, December 31st, 2017. And so if you'd like to re-enroll in the Georgia Tech Identity Theft for the 2018 plan year, calendar year, you will need to take action on that through TechWorks and enroll. All right, the cost is $7 per month. $7 per month for identity theft, and it covers you as well as your dependents. All right, so that's spouse or dependents up to age 26. Identity theft re-enrollment for 2018 does require action if you'd like to continue the Georgia Tech plan. Right. Next up is life insurance and short-term disability. So if you would like to sign up for life insurance, you will do so through the One USG Connect benefit portal. You can log in through TechWorks. It'll take you directly to the portal once you log in through TechWorks. And you can sign up for life insurance, supplemental life insurance. So we know we have the basic life, $25,000 free basic life policy. That doesn't require enrollment, but if you wanted to buy up from that plan, then you have the opportunity to enroll in employee supplemental life. One times your salary does not require EOI, evidence of insurability, meaning a medical questionnaire that goes through underwriting at Minnesota Life. But if you choose to enroll in two or more increments of your salary from maybe where you currently are, then it will require EOI, evidence of insurability. If you are not currently enrolled in short-term disability and you'd like to enroll in it next year, you'd like to enroll in it for 2018, you must take action during open enrollment to enroll in short-term disability. If this is your first time enrolling in it since a new hire, you never had it before, you will be subject to EOI as well. Medical questionnaire, medical underwriting goes to MetLife to make a decision. And for both plans, once a decision is made by the insurance company, your benefit will be effective the first of the month thereafter. Again, open enrollment is your time to explore your choices. And in regards to short-term disability, you want to make sure, if you are looking to grow your family, looking to have another baby, add an addition to the family or a new addition to the family, then short-term disability will cover you for maternity needs. Right? So those are some things just to remind you of, especially the Georgia Tech communication versus the USG communication. EAP Counseling Service. EAP is the Employee Assistance Program. This is, we have a vendor. Our vendor is Aspire. And this is where you receive free confidential services from licensed counselors and or resources. All right. It could be a private challenge for you, the employee, maybe it's a family member as well. But they are free, confidential resources and support for our employees to make sure that you're coming into work with the best mind, the best spirit as possible. So EAP again is a resource for all USG employees. If you do have a challenge that you're experiencing and you need to talk to someone, It can be something that recently happened at work, something at home. So once again, it's either or, but you do have access to and have a support system that's confidential through our EAP provider, Aspire. You do have free counseling sessions, up to 8 free counseling sessions per year per occurrence, and beyond your 8 sessions, they will refer you out to a private practice, right? A private counselor. So I think one question has come up before is, do you have to have medical insurance in order to use the EAP services? You do not have to have medical services, a medical plan, USG medical plan for to obtain services through a EAP. But remember, outside of those free sessions, they will refer you if you require um, an extension of services, extension of care. Then they will refer you out to a private practice, which you will need to have insurance for to cover those visits. So that's something to keep in mind there. Okay. Here's a list of some of their services. Aside from counseling services, you have legal resources, financial, child care, elder care, adoption, academic and special need resources. Out on their website, they have different portals for each of those resources that they have. They have webinars. They have online repository for recipes. So it's a very resourceful website. Benefit here for USG employees. If you need to contact them directly, you'll see their 800 number here, 888-960-3305. And then you'll see their website there, which will require the website access will require the USG password, which is USG Cares. So please, by all means, if you or a coworker needs this information, just please share the information. It is here, a wonderful free resource. All right, and so next up is how to enroll. So most of our seasoned employees, you may be aware that TechWorks has always been the go-to place for enrollment for open enrollment. Well, it's still the go-to place for open enrollment, all right? Remember, through TechWorks as a Georgia Tech employee, you will have access to the Georgia Tech benefits that we spoke about today. And that's the donated sick leave and re-enrollment in identity theft. All right. I know we did speak about the Delta Dental HMO plan, but actually USG did incorporate that dental plan in their enrollment portal. So you do not have to access Delta Dental HMO plan in TechWorks, in the TechWorks open enrollment. You'll have that in the One USG Connect open enrollment. But yes, so if you're in TechWorks, you go out there, look at your mailing address. You can confirm your retirement enrollment, vacation sick leave balance, and there's also a link and more information about Unum Whole Life if you'd like to pick that up now during open enrollment. That's a separate whole life, permanent life insurance plan through Unum. That's Georgia Tech specific, and you have to dial an 800 number to get to them to enroll during our open enrollment dates. But yeah, so you can do all of that in TechWorks. And once you go through TechWorks, there will be a link to link you out to access the One USG Connect to enroll in your medical, dental, life insurance, disability, HSA, and FSA benefits. All right. So again, TechWorks is your one-stop shop to have to make sure you have access to the Georgia Tech benefits as well as One USG benefits. Now, if you're someone who is not technically savvy, or you rather wait till you get home, and you're a person who likes to get assistance as you're going through the system, or you'd like to talk to someone to enroll, you can do so by calling the One USG Connect call center. They do have specialized USG specialized representatives available Monday through Friday from 8 a.m. to 5 p.m. Eastern Standard Time via their call center. That number is 844-587-4236. And so once again, that is the USG call center. They do have a dedicated call center, so you can call them directly to enroll or make changes over the phone. Confirmation statements will be sent out. Confirmation statements will be sent out via mail, as well as you'll have access to print it online. Remember, our open enrollment dates are October 30th through November 10th, 2017. Benefit changes will take an effect January 1, 2018. This is just giving you more information on the One USG Connect benefits resource there. This is for both active employees, leave of absence employees, COBRA participants, as well as retired USG individuals. All right. So now we'll walk you through how to access your open enrollment portal. So if you have not familiarized yourself with the One USG Connect benefits portal, I'm about to walk you through the steps now. So the first step is you would access TechWorks and log in. You will enter your GT credentials, log in. You may go through Duo. Once you are here on your Georgia Tech TechWorks homepage, I think we're on George P. Purdell's homepage, you'll see the open enrollment line item there to your right. You'll see the Georgia Tech open enrollment, whereas you can click there. If you click there, going through the Georgia Tech open enrollment, you'll have access to the donated sick leave pool for donation, as well as re-enrollment into identity theft. All right. So that's where you will access Georgia Tech open enrollment. And once you go through identity theft, you enroll or not enroll, or maybe even donated sick leave, you'll have links there within that portal that will link you out. Will redirect you to the One USG Connect Benefit Center. Now, if you reach this page, if you're here on this page and you just want to go directly to access One USG Connect, you'll click on that bottom link in the middle column there where it says Access One USG Connect OE. You'll click there and it will redirect you to the One USG Connect portal. So we're going to click there on the One USG Connect. If this is your first time visiting One USG Connect, you will come to this USG institution clicker page. All right. So you'll click on Remember My Choice in the top left-hand corner there on that yellow strip, and then you'll select Georgia Tech's icon. Once you select Georgia Tech's icon, it will send you to your homepage of the One USG Connect portal. So this is what your homepage looks like. You have healthcare. It is confirming your main benefits here on this page. You'll see healthcare, comprehensive care. It'll tell you if it's you only or you independents. You'll see dental, vision. So this person looks like he has healthcare as well as he's healthcare because he's enrolled in a comprehensive care plan, and then he has the Delta Dental High plan. The vision, he does not have any coverage. But nevertheless, we're here for open enrollment. And so it's showing us that we have two messages in the top right-hand corner. So if we click on that number 2, your message box opens and it tells you to make your open enrollment choices and that your deadline is November 10th. So you'll click on that line and then now you're to the open enrollment portal. You have reminders. It's telling you welcome to open enrollment. Tells you how many days you have left. Then it also tells you, gives you the time period in which you need to submit your elections. Open enrollment is open until 11:59 p.m. on November 10th. And this says Central Standard Time, but actually just for sampling purposes, it is Eastern Standard Time. So it'll be 11:59 Eastern Standard Time for open enrollment. That's the deadline for open enrollment. You'll see the two green boxes here, one up the top and one in the middle of the page, research and enroll. That's how you access open enrollment. So clicking on research and enroll, it'll open you up to your actual open enrollment page. On this page, on the left-hand side, you'll see a list of all of your 2017 benefits. It says current benefits as of today at the 2017 rates. Now, on the right side of the page, you'll see next year's benefits, and it says beginning January 1st, 2018. And so if you come here and you haven't made any choices, you'll see the same plans on both sides, with the exception of flexible spending account, but you'll see the same plans on both sides. On the right side, it'll just have the 2018 rates. All right. But you can go into each benefit and click view and change to make any changes you'd like to make. Add a dependent, drop a dependent. You can do it all within each line item. Now, we were speaking about EOI earlier, evidence of insurability. And so we're going to select life insurance, supplemental life insurance. All right. And so we've selected life insurance, supplemental life insurance. We're here. And it looks like currently we have this person is enrolled in 2 times their annual salary. That per pay period cost, it looks like it's $60.64. And if I wanted to increase to 3 times my annual salary, which is 1 increment, I can do that without EOI. However, if I wanted to increase by 2 increments up to 4 times my annual salary, 4 times or even up to 8 times my annual salary, that little line there below says evidence of insurability is required. So that link there will take you out to the web-based form. There's a web-based form, web-based document you complete here that will go directly to Minnesota Life if you'd like this coverage. Now, if I did select 4 times my annual salary, what will happen is the system will automatically give you that 1 increment, which will be 3 times my annual salary, until my approval comes in for the extra increment, which will put me up at 4. And remember, once that EOI is approved, if it is approved, Minnesota Life will send you out the approval, mail you out the approval, as well as they will let OneUSG Connect know, and the benefit will be applied the first of the month after your approval. All right. Another thing we spoke about, here is giving you a reminder about the EOI. But another thing we spoke about were your beneficiaries. You want to go out there and take a look at both your basic life beneficiaries, and if you are enrolled in any supplemental life insurances, you want to go out and make sure that your beneficiaries are listed there as well. All right. Now, it looks like this person has completed their open enrollment, and so they want to make sure they're saving everything. And so it says you may return, make changes to your choices anytime before open enrollment ends. This is true. You can go in and out of this portal and make as many changes as you like. Just make sure you save your changes. After each time you go in, if you save, the system will generate you a new confirmation statement each and every time. This person submitted their elections. So it gives them a confirmation number up top. It's kind of fuzzy, but it does give them a confirmation number up top. So you can write that down or print this page here for your records. Again, confirmation will also be sent to your secure mailbox here within this USG portal. And then it also gives you some action items. It says, hey, you enrolled in coverage that requires evidence of insurability. So there's a link out there to complete that online form that will go directly to Minnesota Life or MetLife if it's short-term disability. Now, this person has completed their open enrollment. And if you remember earlier, in our message box, we had 2 messages. Now we have 3. The third message is telling you about open enrollment is still there, but it's also telling you about your evidence of insurability form is here. And then a confirmation statement will also be in this box. Okay. Now, if you log out and come back in, it looks like this person logged out and came back in the same day. And it looks like they may have enrolled in the HMO plan as well, because down there at the bottom it says primary care physician required. So that could mean that they enrolled in either the Blue Choice HMO plan or the Kaiser HMO plan or the Delta Dental HMO dental plan. So you want to make sure your action items are all done. So this person looks like he has 3: evidence of insurability, beneficiaries, and primary care physician. Now, some other resources that are embedded within this portal. That's what I'm about to go over now. The first one is a health cost comparison summary. And so by you being enrolled in a USG medical plan, your USG medical plan is connected to this portal. What does that mean? That means that it has a summary of your year-to-date totals to date. All right. So if you've been to the doctor and you've paid 4 copays, it will show that you paid 4 copays, or what was kind of like your explanation of benefits. Kind of shows just a summary of your explanation of benefits year to date. And so if you wanted to take that same information and compare against a new plan for 2018, you can take that information and apply it and see how your utilization this year looks on another plan. to kind of help you kind of figure out if this plan is more beneficial to you. Is it a cost saving? Will it cover more than the other plan? Vice versa. Right. So that's the health cost comparison summary. Next up is the health plan comparison chart. This one looks very similar to something that you may have seen before. And so you can choose up to 3 plans to compare. You can do this for medical as well as dental. You can choose up to 3 plans to compare, and you'll see the plans side by side, be it the networks as well as the premiums. And then moving on down to maybe co-pays or co-insurance, you can see them. You can look at them side by side. Medical expense estimator, that this is here. So say for instance you are not enrolled in a USG medical plan, and so they couldn't pull any information from your previous insurance carrier, but here you can put in your demographics or your utilization as you've used maybe on a different plan, and put in your estimated cost, and then apply them to any plan that you're looking for more information to possibly enroll for the new year. So that's what your medical expense estimator is. It allows you to see all of your expenses related to your health plan to assist you in choosing the options that are right for you. Provider Direct. So as we saw as a reminder on one of the previous pages, if you're looking for a provider for those HMO plans and you need to apply a PCP to them, you can look right here in this portal. You don't have to leave the portal. It's embedded in the portal. You type in the location you wish to search, the type of concentration that you'd like to search for a doctor in. Look for a provider. You find the provider. If you're choosing one, you click on it and it's applied directly to your plan. And so then it goes directly to the vendor, and the PCP is notated on your actual insurance card when you receive it. Okay. So that's another resource here in the portal. Last but not least is Castlight. So as we spoke about earlier with the Consumer Choice HSA plan, and with those services for the comprehensive care plan that are outside of normal doctor's office visits that require you to pay out of pocket expenses, like an outpatient surgery or MRI or something like that, you can log on to Castlight and search in whichever area you'd like to search in for the prices, the rates of an MRI. The rates of an MRI in downtown Atlanta versus a suburb may be totally different. And so you can choose the facility. You can look at the ratings for the facilities. You can look at the credentials of the physicians that are in the facilities. You can look for feedback, quality, and care there out there in Castlight. You can shop around for prices as well. So Castlight is a wonderful tool and a resource that is available to you out there in the portal as well. HSA contribution calculator. You can type in your expenses that you've experienced maybe for this plan year, and to kind of help you guesstimate how much you'd like to put aside for the 2018 calendar year. So it's a simple worksheet, and actually you'll receive one of these in the mail as well. It'll be on the back of your worksheet, your open enrollment worksheet. So a very great tool as well to kind of help you figure out how much you should actually put into your health savings account. All right, and so that pretty much concludes our this open enrollment session. I'm so glad you were able to join today and log on and listen to the open enrollment material for 2018. Remember, open enrollment is a very important time period. It's time for you to choose your 2018 benefits, so please utilize your time wisely and log on to the systems to make your enrollment options for 2018. And we have the website as a reference here at the bottom, ohr.guytech.edu/open enrollment. One last thing I wanted to add on here is about family status changes. Family status changes in the system here is known as life events. If you have a family status change or a life event, you want to make sure you go ahead and make that change right now, currently, because you only have 30 days to make a life event. Remember, open enrollment takes place, all changes in this system during open enrollment takes place January 1st, 2018. If you need to add a new baby to your insurance, you need to do so within 30 days. You're divorced, you need to drop a spouse or a child. Given the event, you must supply supporting documents and make the change within 30 days of the event. All right, so it's very important. You can call or log on to the One USG Connect system to make those changes, and as well as making your open enrollment changes. So, okay, once again, my name is Benedra Williams. I am the benefits manager here in the Georgia Tech Office of Human Resources. Thank you so much for joining today to listen in for the 2018 changes. Have a great day and embrace your well being.